Have you ever noticed a tiny bump or growth on your skin and wondered what it was? Sometimes these growths can be completely harmless, but other times they signal something more. Today we are going to talk about a specific type of growth in a sensitive area. HPV genital warts are growths that appear on the skin in the genital or anal area and are caused by certain types of the human papillomavirus. These warts are a common sexually transmitted infection and can vary in appearance from small flat bumps to clusters that resemble a cauliflower. They are typically not cancerous but can be a cause for concern and discomfort. The human papillomavirus, or HPV, is a very common group of more than 100 related viruses. Certain types of HPV are known as low risk because they primarily cause warts and are not linked to cancer. These low-risk HPV types are usually transmitted through skin-to-skin contact, often during sexual activity. Once the virus enters the body through tiny breaks in the skin, it can cause skin cells to grow rapidly, leading to the formation of warts. The time between exposure to the virus and the appearance of warts can range from weeks to months or even years. This wide range makes it challenging to pinpoint exactly when or from whom the infection was acquired. If you suspect you have genital warts, it is important to see a healthcare provider for an accurate diagnosis. They can visually inspect the area and may perform additional tests if needed. While there is no cure for the HPV virus itself, the warts can be treated or removed. Treatment options include topical medications, freezing with liquid nitrogen surgical removal, or laser therapy. These treatments aim to remove visible warts and alleviate symptoms. However, even after treatment, warts can sometimes reappear because the virus remains in the body. What is interesting to note is that the HPV types causing genital warts are different from the high-risk HPV types that can lead to reproductive cancers such as cervical cancer. Although genital warts themselves are not typically a precursor to cancer, their presence signifies an HPV infection. Most HPV infections clear up on their own without causing any health problems because the body's immune system usually fights off the virus. However, persistent infections, especially with high-risk types, can be problematic. Regular screenings and vaccination are key for overall HPV protection. Understanding HPV genital warts empowers you to take proactive steps for your sexual health and well-being. Knowing how these warts develop and the importance of medical evaluation helps you manage symptoms and reduce transmission to others. Prioritizing regular checkups and open communication with your healthcare provider are essential for comprehensive care and peace of mind.